Vaccines may be the most important disease prevention tool that science has ever seen, but they aren't without their hiccups. I'm Monique Evans with your latest health news. In a new study, researchers found that although the Tdap booster vaccine protected against whooping cough in the first year after vaccination, its effectiveness declined to less than 9% after 4 years in teens who were given a newer form of the shot as babies and children. Researchers said understanding why the vaccine failed is a matter of some urgency, when considering that an estimated 16 million cases of whooping cough occur worldwide each year. Whooping cough is a highly contagious respiratory disease that causes a severe hacking cough that can last up to 10 weeks. It is especially serious for babies and young children. This study looked at the effectiveness of the Tdap vaccine among adolescents during the 2010 and 2014 whooping cough outbreak in Northern California. Researchers found that routine vaccination at age 11 and 12 did not prevent the outbreak. In a press conference, Dr. Klein stated, because Tdap provided reasonable short-term protection, it may contain whooping cough more effectively if it is administered to adolescents in anticipation of a local outbreak, rather than on a routine basis at age 11 and 12. Talk to your doctor about the best way to prevent whooping cough.